Hospital ramping is an enduring problem in Western Australia. More people than ever are presenting at already crowded hospital emergency departments due to the state's rapid population growth. Demand for ambulances has also grown substantially. From 2009 to 2012, the number of incidents in the Perth area grew by 23%. During the same period, the total hours spent by paramedic crews ramped at WA hospitals grew by 97%. When our crews are ramped, it means they are unable to hand over their patients to hospital medical staff. Instead, they are forced to wait with their patients in cramped, not fit-for-purpose areas at emergency department triage.
Perth's ambulance ramping levels have reached record highs, leaving emergency departments struggling to cope.
It's reached crisis levels. Ambulance ramping hours twice as high as this time last year.
On July 23rd this year, the ambulance service experienced its worst day of ramping ever, with patients spending 145 hours outside hospitals, the equivalent of taking 10 ambulances off the road for an entire shift. One strategy that is being trialled by St John in 2013 is ASCU, the Ambulance Surge Capacity Unit.
ASCU is an initiative to improve our capacity to respond to priority calls in the community during peak ramping times. We'll bring patients to ASCU, they'll be healthier, they'll start receiving treatment, they'll be more comfortable, and our ambulance crews will then be available to respond to calls in the community. And once ramping starts to ease down, we then transport those patients back to the hospitals via transport crews, which in some cases can be dual load, so we'll use one vehicle to transport 2 patients. One of the unexpected benefits of ASCU is that we've actually realised, because we've got a doctor and a nurse and 2 of our staff here, that we're looking at alternative care pathways, and some of our patients we get to don't have access to GPs immediately. They need to be seen, but they might not need to be seen at a hospital ED. Similar to our silver chain or PRA type patients that we would refer to them, but we can't get them into that pathway. They can come to ASCU, we can actually treat them here and then discharge them home.
For the patient, their treatment pathway has been determined a lot quicker. For us, we're getting out on the road a lot quicker. And for us and the patients, we're not both being ramped at the hospital for hours on end.
The ambulance came within 20 minutes to half an hour, and then the young lad suggested to me then that there was a new unit of St John's attached to Hollywood Hospital. Would I be prepared to go over there? And I agreed, mainly because I didn't want to wait a long time in the waiting room and everything else that happens at a public hospital. Here, it all happened by the time I came up from the car park to the entrance, and I was sitting there reading a book while people were looking into my wife's problems. It can only be an experience that's something that I never thought would be happening, but it has, and I commend St John's for what they've done.
ASCU's been a wonderful opportunity that patients can come here. We can start patient treatment immediately, which is fantastic. So rather than a patient perhaps being sent to the tertiary hospitals when they're busy and can't go straight through to the ED, therefore there's a big waiting period, they can come here, start the treatments. They might have bloods taken to ascertain what's going wrong with them. They might be given IV antibiotics. So it's really, I guess, just starting that patient treatment immediately without any delay in waiting. The results have been so good. We've had patients who are private and they've had perhaps come in with a fractured neck of femur, and they've actually had surgery before we've even gone home for the day. So it's wonderful. Rather than going through the EDs and perhaps being a lengthy process, we've been able to expedite things and commence treatment. I've got nothing but positive things to say.
Part of those patients that we bring is very low acuity. They have to be a priority 3, 4 or 5, and that's what the paramedic decide. When they come here, they get held in a comfortable environment, a hospital bed with some of the treatments, and more improved treatment starts occurring with the patient.
The treatment and the way the swiftness and and everything, in which everything happened, and going straight into the ward and straight into a bed. I mean, it was just really great. You couldn't compare it. You couldn't compare it with anything else that I've ever experienced in terms of taking her to hospital.
sort of thought I might have been having a stroke or something like that. But I eventually got to my phone and rang the wife to come home and briefly explained to her what was wrong. So she rang St John's ambulance then. They then did a blood test and did an ECG on me. The doctor checked me all out. When they did get the result for the ECG, they checked it all through and found that I wasn't having a stroke or anything like that. So then they had to wait for the results of the blood tests to come back. And the doctor explained to me that once he looked at those, he thought I was okay to go home as long as I could walk unaided.
Within the 4 hours, he'd been diagnosed and felt safe that he could come home instead of staying overnight.
ASCU is not the magic bullet for ramping. What ASCU has done, it's nudged the system and to look for alternative ways for our patient management. So again, from a hospital perspective, it just delays the presentation to hospital, but you get a better managed patients once they arrive, so they have a shorter workup time in ED. So it's reduced the workload on the ED units.
As a basic model, this works very, very well. If it were to be rolled out further, there are minor tweaks here and there, but the foundation of what we're trying to achieve has definitely been made here.
It's been absolutely wonderful. I mean, I always look and think that the way I treat my own patients is how I would treat my own family members. So if there was an opportunity for my own family to attend here, without a doubt, if they could not avoid the ED system, but perhaps bypass and come here for their treatment, then that would be wonderful. And most certainly, this is an initiative, if it was continuing to grow, I would most definitely put my hand up to work here.
ASCU has helped more than 500 patients during the trial period and could potentially help many more if support continues to grow. Your continued backing for the unit ensures more and more Western Australians are receiving timely and appropriate access to medical care.